Hello, welcome back to our channel. I'm Dr. Carol, this is Dr. Meg, and we are today going to be talking about some really important ideas around having surgery, specifically if you're having joint replacement surgery, and some of the things that you should absolutely do in preparation and then post as well afterwards.
We've had quite a few people needing some type of joint replacement, if it's knee, hip, shoulder, and what we have noticed over the years is that the people who prepare themselves well, their outcome is significantly better, and they return to full activity so much faster. It's a smart thing to invest in yourself and take the time to really prepare your body. And you need to prepare it on several different levels. So physically, you want to make sure that you're fit. The fitter you are before you go into the surgery, the better your outcome, no matter what. And oftentimes, if you need a joint replacement, you're not able to exercise, but you can do something. You can do core work, you can do some type of yoga, even if it's chair yoga. You can get in the water, you can swim to some degree. Any activity that you can do consistently in at least the 8 weeks leading up to surgery is going to be very, very beneficial to you, especially core work. That is one of the most important keys, is to physically get your body prepared and ready.
Especially if you're having a lower extremity replacement like a knee, important to understand that the weight of your body, so how much weight your body is carrying, is connected and affects your joints. If you have the possibility, and it's really important, the ability to change your diet pattern. I would change it in two forms. One is to release until you get to the point where you know you're doing better with the weight that you have for the new joint to carry. That's the first thing. And the second thing I would do is get your nutrition really spot on. So it's a practice, right? And you know when your surgery will be, and start right away to begin eating whole foods, take off sugar, take off all the inflammatory foods, all of them. No alcohol, no refined sugar, no processed foods, no whites. I always say no whites, which means the white flours, the white sugars, those things. And really take them completely out of your diet and do some foods that also promote anti-inflammatory things like fermented foods, and absolutely take your probiotics so you have an intact gut. So all those things are preparatory too, like Dr. Meg's saying, so that you will have the best experience for recovery.
And then you also want to think about, the other aspect of it is mentally prepare yourself. It's a big undertaking to actually replace a joint in your body. And it's a lot of trauma for the body. And it can be scary going into surgery for a lot of people. So really mentally visualizing, using a really good visualizing technique where you see yourself on the other side and you see how capable you are, you see how pain-free you are, you see the activities that you can't do now that you're going to be able to do with ease. That is a really critical piece, and really hold that image in your head. And every time you feel any kind of angst or fear come up around the surgery, you pull up that image so that it's right there in your file box. You can pull it right up, and it's clear that that's the direction you're heading in. And you create affirmations around that too. I'm strong, I'm capable, I heal quickly, I recover well, I'm going to be incredibly capable post-surgery. Those affirmations and those visualizations are really important tools that you want to use several times a day in preparation for surgery as well.
I always say to people that I know are going into the surgery, and I say, you've seen your surgeon, right? And they think, well, of course I have. And I said, no, you know what they look like? And they say, yes. And they always think to me, where are you going with this, Dr. Carol? And I said, so your mind, virtual reality tools and games they play with now are so amazing, because literally your mind's eye, as Dr. Meg is describing, how you meditate or think about something is your reality. So I say to them, think of your surgeon's face coming to you, your bedside when you finish, and remember these words. Have him say to you, or she say to you, you did better than I ever expected. And just run that movie in your head before you go to bed every single night. "You did better than I ever expected. You did better than I ever expected." And see their face saying it. And that's a really critical piece, like the same idea Dr. Meg is saying. And just start practicing and doing it as much as you need. We also have a hypnosis therapist here at Oasis, and she does amazing work with all fears. But wouldn't it be great if she could help you with a hypnosis program so you could prepare yourself? I think that would be a great tool that I would put in my bag right away.
Those are tools to prepare for getting ready for surgery. And then on the other side of it, you're going to have PT. And most people feel like, okay, I'm done PT, I'm done. But when you're really dedicated to those exercises that the PT gives you, continuing those post-surgery, even after you're done your whatever prescribed course of physical therapy is, continuing those is, it's amazing how well that allows for recovery to happen even faster. And of course, getting adjusted, making sure your nervous system is clear, making sure your spine is really prepared for the experience and through the recovery is critical to allow for a very, very good outcome.
And accept help and ask for it. You know, be ready to receive. You know, say, when people say, "Can I bring you something?" Yeah, sure, bring me a healthy meal. So make sure that you take care of yourself in that way as well. Ask for help, accept the help, and do these procedures beforehand, and you will do beautifully.
Thanks for watching.